Hello and Assalamu alaikum, Ultrascan Diagnostics. Here is the CBCT of the patient that you had requested. The area of interest is the implants and the grafted area, starting with the upper right distal most implant. As you can see very clearly here, this implant is placed slightly buccally. You can see that the implant is placed on the buccal aspect, where very limited buccal bone that you can see here. The implant on the region of the sixth is also placed. The other thing that we have to show is that these implants don't have sufficient bone on the crest, especially on the buccal as well as the palatal aspect. The implant in the region of the sixth, which is the second most from the distal aspect, you can see that there is grafted bone on this aspect right here, but also you can see that there is not sufficient bone around the crest in this region. Mesially, we definitely have bone. Around the implant, we have thin bone on the distal aspect as well. This is the region which is again grafted. We've got good bone in this region. In the premolar region, we've got approximate ridge width of 6 millimeters and a height of 9 millimeters. In the region of the canine, again, we've got a very thin ridge. This is the lateral incisor region. Here, we've got a thin ridge, but if we go deep, we've got approximately 4 millimeters of width with 10 millimeters of height. This is the implant in the central incisor region. Again, placed slightly buccally. You can see that there is loss of buccal plate here, but good bone around the crest of the collar of the implant. This is the bone on the upper left lateral central incisor region. Again, excellent bone all around, palatally as well as buccally. This is the upper left canine region. Good bone. We've got grafted bone on the buccal aspect, as you can see right here. And then moving to the implant in the second last distal most implant on the left hand side, we've got grafted bone around it here also, and then we've got grafted bone around it on the crest, close to the crest as well. This is the distal most implant on the upper left side. Again, excellent grafted bone close to the apex. You can see all of it right here. Grafted bone around the buccal aspect as well. Especially more bone towards the distal aspect of the implant, and you can see it right here. The grafted bone is not very radio opaque, but apart from that, you can still see all the grafted bone around the implant. The distal area of the upper left aspect has very limited bone in the premolar region, but in the molar region also you see very limited bone. Just very distally you will be able to appreciate bone. Here we've got 9 millimeters of width with approximately 5 millimeters of height.